A confirmed case of Ebola is in the United States, and now the Centers for Disease Control and Prevention has the momentous task of calming fears from coast to coast. Thanks for joining us. Paul is off tonight.
And that case, as you can see on the map behind us, has now been confirmed in Dallas, Texas. The patient is now in isolation. The CDC is not naming that person, but did confirm he returned from West Africa. They
also laid out a timeline for how this all happened. According to the CDC, the patient left Liberia, Africa, September 19th. The next day, he arrived back in the U.S. 8 days later, September 28th, he went into isolation at Texas Health Presbyterian Hospital.
Texas Health Presbyterian Hospital in Dallas is now treating the first Ebola patient diagnosed here in the U.S. The CDC is reassuring the public.
I have no doubt that we will control this importation or this case of Ebola so that it does not spread widely in this country.
Doctors say the man flew to the United States from Liberia, where the outbreak has escalated, but he had no symptoms at the time.
At this point, there is zero risk of transmission on the flight. Once those contacts are all identified, they're all monitored for 21 days after exposure to see if they develop fever.
The patient actually came to Texas Health late last week, but was sent home with non-specific symptoms. The patient returned by ambulance on Sunday. Ebola is only spread through close contact with infected bodily fluid.
The virus could make its way here just as easily as it did in Texas.
And with all the tourists that flock to Las Vegas, our city could be a destination for people possibly infected visiting from areas where Ebola is prevalent.
Doctors say it's a coordinated effort between hospitals, the Southern Nevada Health District, and fire departments. They say the keys to stopping an outbreak are identification and isolation.
It's a scenario that concerns the chief of staff at University Medical Center.
The difference is the lethality of the virus, and it has been lethal up to 90% of the time.
And doctors across the valley.
It is concerning. Obviously, it's in Texas. It's not immediately here, but that could happen anywhere throughout the country.
Millions of people visit Las Vegas every year. UMC Chief of Staff Dr. Dale Carrison says one of those tourists could carry the Ebola virus onto the Strip, into resorts, and cause an outbreak.
Where are they most likely to come in from the United States? They're going to come in through the airport.
The infected person would most likely not even know they had Ebola. Once a person has the virus, it can take 21 days for symptoms to appear. Even then, the person might just think they have the flu or common cold.
Fever, fatigue, headaches, muscle aches, and sore throat.
The first line of defense would be first responders, supplied with gloves and masks to protect themselves. Then the patient would be taken directly to UMC.
UMC is fortunate in that we have a infectious disease physician that's employed by the hospital, so somebody that's here all the time.
There is no cure for Ebola, but Carrison says the United States has strict healthcare guidelines that would slow the spread. Doctors would take the same precautions they already do for illnesses like hepatitis C or HIV.
Now, Ebola is spread through contact with bodily fluids. Doctors say the best way to protect yourself is to wash your hands, stay away from infected people, and report the case immediately, of course. For more information on that, how to stay healthy and keep yourself from being infected, we have a link to CDC's website on 8newsnow.com.